Hi, my name is Dr. Theadia Carey, and I am the Program Director for Psychiatry Residency Training at Authority Health, General Medical Education here in Detroit. And I have joining me this afternoon Dr. Sherell and Dr. Schmidt, two of my psychiatry residents. We're discussing mental health for Mental Health Awareness Month, which is in the month of May. And today, I know that there's been a lot in the news about COVID and how it's been affecting us here in Michigan for the last 2 months. And there's a lot of data coming out about how it's adversely affecting health and well-being. And so there was a study by the Kaiser family, and they found that nearly half of the Americans questioned said that the coronavirus is adversely affecting their mental health. And so I know that we talk about the first responders, but I'm really seeing psychiatry as kind of our second level responders, because we're going to be the ones taking care of the patients, the first responders, the family members of patients that have contracted COVID-19. And so I just like to start off by asking my residents, what do you see as being our role as mental health professionals in this time post-COVID?
Hi, my name is Dr. Peguy Schmidt. I am a third-year psychiatry resident. And given what I'm seeing in the news right now with COVID-19, I'm seeing a lot of despair. I'm seeing a lot of depression happening. Matter of fact, in the patients that I'm seeing, I see an increase in substance use disorder. I see an increase in suicide attempts. I see patients decompensating. They were previously stable, and then because of everything happening in the news, information overload, they're just decompensating. So in terms of the role of psychiatrists in what's happening right now, I'm thinking, just like Dr. Carey said earlier, we are the second wave of responders, because not only we have our regular patients decompensating, we have new people coming in because of death in their family, because of not knowing how to deal with everything that's happening, whether it's job loss, whether it's the fear of contracting the disease itself. It is very anxiety inducing, especially with the information overload happening in the news.
Yes, that is so true. And that's one of the things that I actually recommend to my patients, is to turn the TV off, like don't go on Facebook and read news updates, to give themselves a break from all of the negative information that we're hearing. Dr. Sherell, what have you been noticing in this time?
Yeah, so my name is Dr. Dayne Sherell. I'm a first-year resident with Authority Health. And I have to echo many of the things that Dr. Schmidt also said. I'm seeing a lot of people who are decompensating. One of the primary things that I'm hearing from them is that they're finding the loneliness and sometimes even the feelings of abandonment to be quite heightened during the isolation, and they are decompensating because of that as well.
Yes, yes. And I was wondering, because the studies are showing that depression is increasing. And in the past, when we've had other infectious outbreaks, depression increases. What are some of the things that you're recommending to your patients to help them cope or get through this time?
In terms of recommendation, it has multiple layers. With the depression itself, the patient presents with some symptoms of depression, but it seems like a lot of them, they just have adjustment disorder. So I don't go directly in terms of prescribing them medication. I refer them to some apps for meditation, some app to help them with their sleep hygiene. And then, of course, we talk about the information overload, because if they stay and take all the negative news, it's just going to aggravate the situation for them. So we talk about that. Also, I refer them to therapy helplines, because just talking about what's happening can help. So instead of going straight to medication, we talk about what's happening, and then I give them wholesome way of dealing with the problem.
And
Yes.
most of the patients that I've seen so far have been on the inpatient unit. So our goal has been with trying to reestablish them on any medications that previously have worked for them, but maybe because of the disruptions in services as it's related to, the pandemic, we're trying to basically get them restarted on those medications, and as well as trying to teach them therapeutic ways of restructuring their lives with things like guided meditation, journaling, attention to sleep hygiene, proper nutrition, things that they can really control within their isolated environments.
So one more thing that I'm seeing in patients, the new patient that I'm seeing right now, I am at Hagira, a crisis center, and a lot of patients are coming in, and their depression is due to their new social situations. In terms of, a lot of them come with homelessness. So I see two different types of the reason why they come with homelessness. The first one is they were living with family, and their family members are uncomfortable having them around, and they're afraid that the patients that I'm seeing will infect them. And then it's the other way around. Sometimes the patient themselves don't want to infect their family because some family members, like they have babies, etc., so they don't want to be in the house. So basically they are in the streets. And of course, whoever doesn't have shelter, when you're supposed to shelter in place, it's not going to be easy on them. So this is not an easy fix.
Yes. There's a lot of problems that our community is experiencing in Detroit, as far as homelessness, lack of income, lack of food and other needful necessities, being able to access those, as well as accessing health care. And yes, it's not going to be a quick fix for any of the magnitude of the problems our community is experiencing. I want to touch on one of the things that Dr. Sherell mentioned. He talked about working with our colleagues in healthcare. And, what are your thoughts on how we can support our colleagues in medicine, our nurses, our social workers, other physicians, because they are dealing with the same struggle as the community as a whole with COVID-19.
Yeah, so I think it's so important because a lot of times they will see our psychiatric patients before we will see them. So I think it's important that we help them figure out ways to devise screening protocols or guidelines for the patients that are coming to their offices. It's also important for us to make sure that there are mechanisms in place for the instances that they actually do have people that have a positive screen for issues related to any types of mental illness related to the stress they're seeing as a result from the pandemic.
And to add to that, I think we should increase education about symptoms of depression, symptoms of anxiety, adjustment disorder, and also somatic symptoms. Because some patients, they don't express their psychiatric problem as just psychiatric problem. It will come as a somatic problem. Sometimes we have to educate not only our colleagues, but also the community about it. Some patients, their depression does not just express about lack of sleep or increased sleep. Sometimes it's just anger. And they have to be aware of that, especially in the, I would say African American community, they tend to not want to seek psychiatric help a lot. So increasing the education about this and dispelling the stigma about coming to your psychiatrist to talk about your problem can help, because COVID-19 it's been a while now, and it seems like the experts are saying we don't know when it's gonna stop. So the more we're exposed to the news, the more we're exposed to that fear of being infected and infecting our family, the more we the probability of developing psychiatric problem will come. And if you don't know how to recognize it, how do you seek help? So us as psychiatrists, we can increase the way to reach out to the community and our colleagues and educating them about what to look out for and how to screen, like Dr. Sherell mentioned, in order for us to make sure that the patients who need help, whether they are in the community, lay people, or our own colleagues, they know how to recognize it and seek help.
Yes, and the other thing I would add is that we do need to provide our frontline workers, the police, EMS, nurses, other physicians, assistance in dealing with stress, how to avoid burnout, making sure that, I know it sounds selfish, but to take care of themselves first, because if they're not healthy, they really cannot provide the care that's needed. And I am so proud of many organizations have started helplines manned by volunteer psychiatrists to provide that support, whether it's individual or group, to our frontline workers so that they can avoid burnout and be healthy and provide the help to the community that is so needed. The one thing that I did notice in my readings about how communities deal with a pandemic or an infectious disease, many times there can be fear-related behaviors, such as avoiding going to your physician for an immunization, thinking they're going to infect you with the disease, or avoiding physicians entirely because, well, they might have it and give it to me. So have you seen any fear-related behaviors in the community that you're seeing, and how might we counsel them so that they don't worsen their own physical and mental health?
I actually have seen decrease in medication adherence because of that, because I have patients who, after spending the first month of stay-at-home order not having their medication, they finally decide to come in and they say, well, I didn't want to get infected if I come to the hospital or to the doctor's office, and I have to, well, I've spoken to the patient and talked to them about how medication adherence is very important, especially during this time, to make sure that their symptoms don't come back.
Yes, I've actually been seeing the same thing. People who are very concerned with, okay, am I going to catch this from one of the doctors? Possibly, am I even going to catch this from you? You know, so I've seen a lot of patients who have just been uneasy with me even entering the room. And we really have to work hard to try to allay as many of their concerns as possible. I think a lot of it comes down to having to acknowledge that there is just some uncertainty right now in the world that we are going to have to try to figure out ways to kind of accept. And we're going to have to rely on some of our guiding basic principles that we've always used in times of uncertainty, even during these times now.
Yes, and also counseling them on health promoting behaviors. So I had a patient tell me, oh, when I go to the store and people get too close to me, I tell them, oh, you can't get close to me, I have COVID. And I had to explain to her, you know, you're putting yourself at risk. They're afraid of getting COVID-19 as well. So what if they decide to beat you up or run you out of the store or do something else just because you want to just keep that social distance? So you're saying a phrase that could actually put your life in danger. Or I have patients that are already saying, oh, well, I can't get any of my long-acting antipsychotics via injection because you might inject me with COVID-19. And so counseling them, see, this is the same package we've always used. It has your name of your medication. So spending a lot more time educating patients, educating them what is healthy. So just because your young son went to the store for you because you're older, you can't spray him down with Lysol before you let him in the house, because that could adversely affect his health if he was to inhale it. And so really listening to our patients to see what they're doing in their day-to-day life that could work against the health and well-being of their families, which is their ultimate concern, is that everyone be safe. Has anyone seen any other fear-related type of behaviors aside from avoiding the medical profession, not taking medications?
In terms of other fears, I've actually seen patients who tend to scapegoat. They tend to be very scared of going to Asian markets or even talking to Asian people from Asian descent. And I've educated them about the fact that the virus is non-discriminatory. We all can get it, and it doesn't have to be from one single type of people. So yeah, I have stressed and educated them that we're all in this together, and it's not just one type of people who get it.
And what I'm noticing now is that we are beginning to return to work, and what is going to be our new normal way of living. And a vast majority of Americans are reluctant to leave their houses and return to work. How do we help ease the concerns of people and help them feel better about leaving their home, applying masks, and getting on with their lives?
Mostly, again, it goes back to educating. It goes back to teaching them how to keep safe. Again, it's the 6 feet. You have to distancing. You have to respect that. You have to know to wash your hands more often than you used to. If you weren't used to washing your hands, make sure you have your mask. And the mask is not really to. It's mostly to protect the next person. So again, it goes back to altruism. When you put your mask, the next person will not get the disease. It's just the same thing for the next person. You have to put the mask so you don't get the disease. So it's all about educating, because life has to go on eventually.
Yeah. And I think it's also about directing them to the science and trying to make sure they understand that these aren't just kind of random rules that we just came up with, but they're actually based on, evidence that we've had that it can actually help to control the spread of this virus. And I also think as they start to see the numbers come down, they will kind of feel a little bit more comfortable with leaving their home as well.
Yes, and one of the things that I have to tell my residents, my other faculty that work with me in the clinic, the nurses, the nurse practitioners, is that we have to start by focusing on what we can control. We can get enough sleep. We can eat right. We can exercise so that we are healthy. We can wear our masks and our gloves, and we can wash our hands frequently so that not only are we safe, but we're keeping our patients safe, we're keeping the community safe, and avoiding too much news, because they tend to focus on the negative, and we're not hearing all of the stories of recovery from COVID-19. And there was an interesting news article I saw a couple of weeks ago specifically for healthcare providers, and indicating that by them participating or joining in with whatever their religious faith is, that actually helps them avoid burnout. So staying connected to their value system, whether that's a religious institution or something else, staying connected to those values can also give us a sense of grounding and help us avoid burnout and keep ourselves safe.
I've heard people say it's not really social distancing, it's more physical distancing, but keeping our social connection, because again, without the physical touch, it's really hard for most of us to function, because we like to be around our friends and family and loved ones. So having that social connection, making sure you nurture it, can help while keeping the physical distance.
Well, we want to make sure the community know that there are resources available. If you or someone you know is struggling with mental health issues, help is just a phone call away. It's 888-PEER-753, or it's 888-733-7753. Also, the Michigan Psychoanalytic Institute is offering free crisis therapeutic counseling, and they can be reached at 248-907-4407. Well, this concludes our discussion today regarding mental health awareness in honor of Mental Health Awareness Month here in May. And I'd just like to really thank my residents, Dr. Sherell and Dr. Schmidt, for joining me for this discussion today.